welcome to the Birth and Body podcast. This is Bethany Stricker, and I'm just thrilled you are tuning in. I'm a licensed midwife in the DFW, Texas area and serve families through the midwifery model of care by offering preconception counseling, prenatal care, and home and birth center birth. This podcast is all about women's stories and voices and meant to be an encouragement and resource for all things women's health and wellness. If you are enjoying the podcast, we would so appreciate your support so that we can continue offering this resource to families everywhere. Please visit the LiberaPay link below this video on YouTube or in the description wherever you are listening to the podcast. If you are a doula or childbirth educator and desire to further your education, or maybe someday you want to be a midwife, I would love for you to join my Steps to Midwifery group, where we study cases and go into detail about all the things we talk about on the podcast. Visit my website at bethanystricker.com for more information or to join the Steps to Midwifery group. Our guest today is Dr. Chelsea Nutt, a Parker School of Chiropractic graduate who specializes in women's health, fertility, and pregnancy. Through her own journey, she has grown her practice to serve women through functional medicine, myofascial release, and intentional movement. I'm thrilled to have her on the podcast to discuss options around family planning, birth control, and hormone imbalance. Just like with birth options, we really want women to know the risks and benefits of birth control so they can make the right informed decision for their family. Thanks for coming on the show, Dr. Chelsea. How are you doing?
I'm good. How are you?
I so appreciate you taking the time to drive down here on this dreary day.
Yeah, anytime.
So I know every chiropractor is a little different, which is kind of nice because you can go the pathway that you're most passionate about. So how did you come to maybe focusing on women's health so much in your practice?
It's a great question. It's been a wild ride, honestly. I'm actually a third generation chiropractor.
Wow, yeah, that's cool.
So
I didn't
it's my
realize
claim to
that.
fame in school. My grandmother was a chiropractor, and my dad is a chiropractor, and they practice very differently. My grandmother was very much like a energetic crystal, into essential oils and all of that. And my dad is a straight chiropractor for the majority of his career. He's just been really good at adjusting, and that's been his main tool. So I grew up with the chiropractic philosophy ingrained in me, which is that the body has the ability to heal itself, and we use the least invasive measure first. Every time I got sick, it was, let's start with vitamin C and colloidal silver and get you an adjustment. So, I just grew up with that. And I also saw how different chiropractic can be. I'd love to say that's why I got into this, but it's not. When I was in high school and through my senior year of college, I really thought I wanted to be a medical doctor.
Okay.
And I realize now that was mostly because I just wanted to be the smartest person in the room, perceived to be the smartest person in the room. But fortunately, I had an epiphany in my senior year of college, and I was like, wait a second. I don't want to just push medications. I don't want medications and surgery to be the only tools in my toolbox. So I decided I was going to go to chiropractic school. Didn't know really then how I wanted to practice or what that looked like, but I was like, I'm going to figure it out. I'm just winging it. And I did, and I wung it all through school and still didn't really know when I graduated. So many people around me were like, I want to go into sports. I want to go into neurology. I want to have this really specific thing. And I was like, I'm still figuring it out. And then it wasn't until after school and after I opened my own practice even, and I had my baby, my daughter, and I was just very lost at that point. And I was kind of going through the motions at work. And I felt very disconnected to myself and my body. And I started learning about functional medicine, kind of finding the root cause of physiological symptoms. And then I started connecting that with what I feel in my own body. And I just realized I just became so passionate about women's health because, I am one, so I can relate. But I think so many women are disconnected from their bodies, and we have all these symptoms and these feelings, and it can be really isolating because if you go to a doctor with these problems and you tell them how you're feeling, they're likely, unfortunately, going to brush you off and tell you that you're crazy. And I think we've all had an experience where we've felt something in our bodies and someone's been like, oh, that's just your crazy hormones or something like that, you know? And I just didn't want to accept that. I kept asking why. And I kept asking why to questions that I didn't even hear anybody else asking. Yeah. And I don't have all the answers, but I have way more answers than I ever did. And I just, the way that I practice and my practice has changed my own life. And I just want to bring that to other women as well.
Yeah, I love that. I think that's a lot of birth workers would relate to, like how many get into birth work or becoming a doula or whatever based on their own birth experiences. And we were talking a little bit before the show, what you're describing as far as doctors just not listening is really how I got into midwifery too, in my own hormone journey. Yeah. In my early, 20s, I guess. And then I happened to becoming a doula at the same time, then a midwife. And it was like a mirror image with women's health issues and then with prenatal care.
Absolutely.
It was unbelievable. Just not, maybe modern medicine not having the time, or maybe the philosophy doesn't encourage the time to listen to all of that.
Yeah, absolutely.
I don't know which came first.
But chicken or egg.
Yeah, it's just not part of the philosophy at all. So I know I love chiropractic because I feel like it is similar to the midwifery model of care.
It is.
Like you're really trying to keep people on track. How can we keep people healthy versus kind of reactive medicine where now we're so far off and have to do all this stuff.
Yeah, it blends really nicely. And I think once you get into a field like that, whether it's midwifery or chiropractic, you start to realize that it's just part of such a bigger issue of how we deal with our health. And it's just like, oh, we're just using all these Band-Aids and this isn't the way. And it can be super frustrating and overwhelming, but you just keep learning your craft and getting better at it and trying to help as many people as you can.
Mm-hmm. Yeah. Yeah. So a little bit of background for the people that listen. I kind of met Dr. Chelsea through Zoom because of COVID. That's right. Because she came and did a workshop for North Texas Midwives, which is our DFW midwife organization. And I schedule the workshops, so continuing education for the midwives. And because she's, I would say, kind of specialized in or done your own research on recovering after hormonal birth control use, maybe kind of out of necessity, like you're describing for women in your practice. And we don't, maybe it might just be particular to our state, but a lot of the licensed midwives in Texas don't have a ton of well woman knowledge. In other states, we can practice well woman care, so we're trained to do it, but in Texas, we can't. Our scope ends at 6 weeks postpartum. So, but we're still we're talking to women about their options. What do you want to do after you have a baby? And giving information. So when you mentioned I could talk about this, I was like, yes, please come. Because that's really how I entered the whole informed consent discussion, was figuring that out for myself, doing my own research and blah, blah, blah. So that's why I wanted to have you on the show, to just have a resource to tell my clients about, if you're looking at these options, at least know the risks and benefits, just like we do for everything else. Absolutely. You've decided your care provider and all these things and what you want to put in your baby's body, and you want to have a natural birth and all this stuff. So then, applying the same thing to your family planning options is not that conversation is not happening enough. And sometimes it feels like it's not happening at all.
I agree. I think part of that is because we only focus on women's hormones when it comes to reproduction. And that's just not, you're way underserving women in healthcare because of that.
Mm-hmm. Using it as a medicine, not seeing it as potential risks too.
Yeah, absolutely.
Yeah.
For sure.
Using it just as a medication when it's not that simple, like you mentioned before.
Yeah.
It's often used as a Band-Aid, and that was my experience personally too.
Yeah, it's one of those things that's we know that compared to the amount of research that we have on men, there's very little on women. And because of that, it's like just a one-size-fits-all approach for every hormonal problem. And they're just like, here's your birth control. When you come off of it because you want to get pregnant, then we'll deal with that. But until then, just put you on autopilot. Just shut that down. And there is literally no regard for any repercussions that might cause. Anytime you mess with, when you go on hormonal birth control, it interrupts communication between your brain and your ovaries, your hormone production centers, right? So anytime you shut down part of your physiology, there's going to be something else that happens because everything is connected.
Right. Yeah. So for people that don't know, often they're going on it because they have irregular cycles or heavy bleeding or acne or endometriosis, which that doesn't make sense, or just simply, pregnancy prevention. They don't realize, I feel like I learned that recently, how it affects your metabolism and your thyroid and all these things. So for people that don't know, how does that connect it on like a physiological level?
Do you have many days to talk about this? I'll try to keep this as concise as possible. In the workshop, I talked about how in my practice, there are basically 3 pillars of health that I address. You have your physiology, how your body is working, your neurology, how your brain is working, and then your psychology, how your mind is working. And all of these 3 pillars are intertwined. They all influence one another. I draw the Venn diagram. You got arrows going to 2-way arrows going to each one. So when it comes to hormonal birth control, and a lot of women aren't comfortable with hearing that we are our hormones, but we are. Hormones are part of the physiology, but there is neurology involved that's going to initiate the cascade of hormones. Our hormones influence our neurology in our brain. And it also influences our psychology, our thoughts, and how we feel. So birth control is not just going to, I think a lot of people talk about birth control as like this, it's just, it's still hormones, right? I'm still getting my hormones. I don't really need to have a period. And that's like the biggest lie that doctors say is you don't need to have a period. You don't need to have a period to survive, but having an actual period, and the period that you get on the pill is not a real period, but having an actual period is so important for you physiologically as a woman, not just because of reproduction, but because it influences your brain health, it influences your emotional health, it influences how we age, it influences all of these things. I'm missing the point of the question.
No, that's why it's also connected, because it's not, I'm just going to take this. It's going to impact your brain.
Right.
You like all the things.
Yeah, we got to talk about all that. We got to talk about how it affects your immune system. We got to talk about how it increases inflammation. We know that. We got to talk about how it influences your insulin response and messes with your blood sugar. We got to talk about all these things that, unfortunately, conventional medical doctors aren't really telling their patients when they give them the birth control. They're like, well, if they tell them anything, they're like, there's a super small risk that you might have pulmonary embolism, but it's like so small that it's practically negligible. But that's not for the doctor to decide. It's not for the doctor to decide what is a big risk to somebody and what isn't.
Right. It's just like with epidural, like everyone feels differently about the risk of an epidural.
Yeah.
Obviously, there's enough people that are concerned that they choose to have a completely natural birth. And obviously everyone's experience of a natural birth is different. Some it's like the hardest thing ever, and some think it's awesome. Yeah. Everybody's different. So same thing with birth control. Because I think we hear sometimes, well, you may become depressed on it. You may gain weight, but not really why that is, which makes sense with what you're saying.
Yeah. And again, I think when you're in the doctor's office and they're telling you those words, you expect to hear that, right? Because we're so just like inundated with commercials about medications. And it's like, in the commercial, it's like a happy thing. And then they're like, this might cause death, or, it like lists all these side effects. And you just become like removed from that. And no one really connects those dots of like, this may cause depression and this is why. Here are risk factors that may increase your risk of depression. Like, do you have any depression in your family history or your personal health history? Like there are just questions that we can ask people and screening that we can do and tests that we can do to make sure that if we are choosing these medications, that first of all, the patient knows what they're getting into. Right. And secondly, we can be smarter to mitigate some of those risks.
Mm-hmm. Yeah. Because I think we often think, oh, that won't happen to me.
Yeah.
But then it could be you.
Yeah. Yeah.
I actually have a friend who we were all at a friend's wedding and she was on oral contraceptives, didn't know she had a blood clotting disorder. Oh, no. And at this wedding, I was not planning to say this, but when you were teaching that workshop with North Texas midwives, I was texting my student. I was like, actually, I know someone this happened to, and she looked like death at the wedding. And I was like, maybe you shouldn't be here. Like, I don't know if you have the flu. I don't know if this is contagious. Right. For the rest of us, maybe you should go home. Like, I'm really sorry, but she looked so pale and terrible. And then the next day when they were going to leave at the Airbnb, she falls down the stairs and is unconscious. And she was, blood clotting disorder.
Wow.
My understanding is she was on her way to having a pulmonary embolism.
Wow.
And of course, this is like a destination wedding in the middle of nowhere. So they end up having to stay there for weeks before flying back to Texas. So it's not... I think kind of like the natural birth movement, a lot of us know someone who had their epidural not work. And then we think, oh, maybe I should reconsider this. Mm-hmm. So when you know somebody, it's like, I don't know about this option. Like,
makes it more real for sure.
Yeah. What are even my other options?
Yeah. And also I think a big issue is that there's so much gaslighting in healthcare.
Yeah.
I know just from my personal experience being on birth control. I mean, I was put on birth control when I was 15. Mm-hmm. I was on it till I was 22. Fortunately, I was like, oh, I'm getting off this and just cut it out. But I mean, 7 years is still a long time, especially I started my first period when I was 13. So within 2 years was on birth control. But when I went on birth control for the first 3 to 4, maybe 5 months, I was like a completely different person.
Yeah.
I slept so much. And when I wasn't sleeping, I was being angry. Like I just I hated the world and I hated my life. And I think after that, I just kind of got used to feeling like crap.
Yeah.
And I made the connection, but I never was like really made the connection. You know what I mean? I never really thought about the long-term consequences.
Yeah.
I mean, I was 15, so I don't really think that was necessarily my responsibility.
Yeah.
But I mean, I was on it for all that time and I look back and I'm like, oh, it just makes so much sense knowing what I know now and looking back and just erratic behavior and just like can't control my emotions, can't handle stress, can't part of that is just being young too.
Sure.
But
then putting that on top of it.
Exactly. Compounding that with artificial hormones pumping through your body at high doses is like a recipe for disaster.
Yeah. And that's just so hard as a teen already.
Yeah.
And then just having no way to cope really.
Yeah, for
with
sure.
It. So I know you mentioned before I told my little story, being smarter with those options. What does that mean? Is it there's ways to be more wise if you do take it, or how would you describe that?
Well, actually, your story was perfect because there is a genetic marker called Leiden factor 5 that increases your risk of clotting, right? And increases your risk of deep vein thrombosis and massive pulmonary embolism by like 8 times while on the birth control pill. And there are millions of people who have this Leiden factor 5. The clotting disease that it causes is diagnosed, I think it's 3 million cases of it a year. Wow. So it's pretty common. And I mean, I think as far as like screening goes, that should just be standard in in women before they go on birth control is this Leiden factor 5, excuse me. Beyond that, again, getting a really thorough family health history, getting a thorough health history and any current symptoms the person's experiencing. You want to know if they have inflammation already. You want to know if this person has an altered insulin response. You want to know if their fasting blood sugar is too high or too low, or even approaching that, right? So in functional medicine, we don't just look at the clinical ranges that are on like when you get your blood work done, you're going to have those ranges. Those are like the disease ranges. Functional medicine shortens those down so we can see if something's approaching that point, so we can hopefully stop it before it gets too bad. This is where lifestyle interventions and supplements are really helpful, is kind of in that approaching that range, right?
Sure.
So just doing some blood work beforehand and checking to see where people are at. Health history, is there a history of depression? Checking to see where their mental state is at. And there are definitely options for like lower dose hormones. Some of it is trial and error. That's the hard part. But there are options for lower dose hormones that might be better for some people. But again, like it goes back to, we have a problem with healthcare in this country, and doctors aren't spending enough time with their patients to get all that information. And it's not necessarily the doctor's fault. And I feel like their intentions are in the right place, and everybody is doing their best. And this is definitely, obviously, this is not a conversation to like bash medicine or bash medical doctors or any of that. It's just about informed choice and being smarter and doing better.
For sure. And so much of that is, the consumers, I think it always is, the consumers doing their own research, asking for the testing before it becomes, oh, this is what women want. This is what we should be doing. How often new research and standard of care is because women are demanding it. I know that's how it is here in Texas, especially DFW. There's so many midwives and so many birth centers and midwives in the hospital, and most places aren't that way, but it's because women have wanted it and it just grows. So I'm sure it'll be the same way with this whole conversation too. Yeah.
It really has grown. When I had my baby 3.5 years ago, there was only like 2 or 3 birth centers in the Metroplex, and it's really blown up, which is great. I love to see that.
Yeah, for sure. And I hope it'll be the same way too for all the testing and helping women recover. So I know that's part recover, especially if they're trying to get pregnant. I know that's partially what you do too. So for someone maybe, if they're considering their options, looking at risks and benefits of it, obviously everyone's in different life seasons, and we've talked about, some women are going to find that's the best option for them. But everyone should know, just like epidurals and all the things, risks and benefits. It shouldn't just be, this has no risk. But say someone is coming off of it and now wants to get pregnant. What does that look like?
It kind of depends. I like to get people in a space before they come off birth control, because then we can make some dietary changes and give them a couple of supplements to kind of help that transition. So one of the things that birth control is really hard on is your liver, and it depletes your nutrients. So that whole like detoxification pathway, all of that synthetic hormone that you're pumping in your body has to be detoxified through your liver, pushed out through your feces. But it's a very, it's not an individualized amount, right? It's just one amount that you take. So it's hard on the liver, and it depletes your B vitamins, and it depletes zinc and magnesium and selenium and all of these micronutrients that are important for detoxification and liver function and gut function and immune system function. So I really like to get people who are still on birth control, because then we can add in some foods that are really good for the liver, like cruciferous vegetable, broccoli, cauliflower, Brussels sprouts, kale, root vegetables, beets, carrots, those kinds of things. And then getting a really good multivitamin not necessarily prenatal, but just a high dose B vitamin for sure, and giving them some of those minerals as well. That helps mitigate some of the effects of coming off birth control. So yeah, just replenishing those nutrient stores and detoxifying the liver is always the first step.
So for someone who is new to that concept of when you take in a medication, I specialize in natural things.
Yeah.
So I'm assuming it's most prescriptions, not just oral contraceptives. The way it passes through the liver, like what it takes for the liver to do that, that's why it's using up so many vitamins and minerals. Mm-hmm. Is that right?
Yeah.
Like why it depletes the B vitamins and magnesium and all these things.
Yeah. I think, like
is it oxidative stress or is it?
Yeah. Oxidative stress.
Okay.
Yeah. And I think it does depend on the medication. Different medications are going to be more damaging to certain areas, but
sure.
The hormones for sure, any hormonal medication is going to be tough on the liver.
Yeah. And just, I think then when we compound like our crazy lifestyles on top of it, it's stress, that much harder.
Yeah.
Okay.
Yeah, definitely. Yeah, that's such a good point, because usually, you deplete the nutrient stores from like an oxidative stress perspective, but then you got to consider, well, what's your gut functioning like, right? And not having a good functioning gut means you're not going to absorb those nutrients, even if you are taking them in a supplement form. Standard American diet goes into that. You're probably not. Our food is nutrient depleted to begin with. Even if you ate everything organic, you still wouldn't have as much nutrients in that food as we did 50 years ago, 100 years ago. So we're in a point where supplementation is necessary. Lost my train of thought on that, but
yeah, because I'm sure that's part of the factor. And some people are going to feel like their worst self on oral contraceptives, and others are going to be like, "What's the problem? This worked great for me."
Absolutely,
but everyone's in such a different spot. And I think for me, I was already not in a good spot when they wanted to put me on it for my hormones. Like there's already underlying issues leading to hormone issues, and then they wanted to put me on this versus how can we actually heal the root issue, versus now I would have been on it for 10 plus years, and then trying to get pregnant would be horrible, knowing what I know.
Yeah definitely. And it's hard because you Google like, does birth control cause infertility? And Google is just going to give you the runaround. Google's going to be like, no. Google's going to show you maybe something that's like, well, it could, but it's going to be like some wacky website that is not credible. So there's misinformation out there, and there's no smoking gun research article that's going to be like, birth control causes infertility. But we know that birth control causes an increase in inflammation, which can lead to infertility. We know that birth control messes with your insulin response, which leads to infertility. We know that birth control thins your uterine lining, which can lead to infertility. So there's like all these different ways, messes with your stress response, and that can lead to infertility. So it's really frustrating as a consumer and as a layperson when you're not immersed in this and you don't know how to even begin to search for this information. You go to Google and it's just like, no. You're like, I'm crazy then. I'm just crazy.
Right. Yeah. Yeah, that's so true. You're right. It's totally the same in the birth world. How often you're like, this happened, and then you try to ask your doctor about it, and they're like, no, that's not what happened, or you never even see that doctor again anyway. So now are you supposed to get your questions answered about your birth? Yeah, that's so true.
So frustrating.
So do you have favorite resources if someone is trying to find good information that's not going to freak them out?
Yes.
Like so horrible.
Yes.
But at least help them, like bird's eye view, like balance.
Definitely. There are a few doctors that I follow that are wonderful on this topic, experts on this topic. Dr. Jolene Brighton is one of them.
Yeah, I love her.
She has a book called Beyond the Pill. It is excellent. She's a great resource. There is Laura Brydon, who is an expert on PCOS. She's awesome. And then there is a psychologist. Her name's Sarah Hill. She wrote Your Brain on Birth Control, and that one was an eye-opening resource as well.
Okay.
So those are my 3 go-tos.
Awesome. Yeah, they're fabulous.
Yeah.
And they reference, I feel like, things really well.
They do.
If someone wanted to look into something even deeper.
Yeah. Ooh, Nicole Jardim as well.
Okay, I haven't heard of her.
She's got a podcast actually called The Period Party
That's
Podcast.
right. I have heard of that.
Wonderful.
Okay.
She's awesome.
Okay. Awesome. And for those, often when I have this conversation with my patients, now they're like, well, what other options do I have? So what do you usually tell people if they don't want to, obviously thinking specifically about the family planning question, obviously,
right.
We have to approach things more holistically if we want to really heal our bodies, not, of irregular cycles or something like that.
Definitely. Well, there are non-hormonal options. You have your copper IUD, which seems to be a decent option for somebody who is wanting pregnancy prevention but doesn't want to be on hormonal birth control. But of course, that is a procedure, and some people are freaked out by that, myself included. Can't do it, won't do it.
For someone who's seen them inserted and assisted with that, everyone's so different, right? Just like with birth, I've had people where no big deal. I mean, for people who don't know, it's literally this device that you have to push through a closed cervix. And some people, that's excruciating for them. I think if you haven't had a baby, like if it hasn't opened before, if you've just had a baby, it's not as bad. But I also recently, I was doing some research on, there's some good info on like copper toxicity from it.
Yes, that is the risk
another
with that.
thing to look into. Not everyone's gonna, respond differently. So.
Yeah, it's definitely not for everybody. And that can cause like really heavy cramping and bleeding as well. So
heavy periods.
Actually, Nicole Jardim just did a little series on Instagram about the copper IUD.
Okay.
So definitely check that out. Other than that, I mean, it kind of depends. There are lower dose hormonal birth controls. There's a light dose of estrogen, progesterone combination birth control, and then there's like an ultra light dose. So if somebody wanted to be on birth control pill, I would probably start there.
Okay.
There's also forms of birth control that they recommend for women who are breastfeeding that are just progestin only birth control pills. It depends on what your goals are. If you want to become pregnant again in the future, that progestin, the action of progestin is to thin the endometrium and change your cervical fluid so that the sperm can't reach the egg or survive in there. Makes it like a harsh environment. So there's going to be side effects with that. You're more susceptible to yeast infections. You're changing the pH and the flora of your vaginal wall, and that's going to cause some issues. It really is just like a what do you care about most type situation. But there is an option for every person, and there's also fertility tracking and fertility awareness, which, if done right, is really effective.
Right. So copper IUD.
Fertility method.
Fertility awareness method. For someone who maybe just had a baby, it's a little harder when you're not ovulating yet and having regular cycles yet. Do you have favorite resources if they're currently breastfeeding and trying to figure that out for the first time?
I think that in Jolene Brighton's Beyond the Pill book, she has a whole pamphlet section for fertility awareness. She talks about it in the book. It's like a chapter, and then she's got a whole thing for it.
Okay.
Breastfeeding is hard, though. You kind of can't when you're not ovulating or not supposed to be or not cycling. So yeah, that's kind of a gray area.
Yeah,
I would definitely recommend a backup method.
Right. Especially if it's new to you and depending on how important it is that you not get pregnant. I mean, everyone, like their scale is really different.
Yeah.
Some people are like, no, I 100% cannot. Then I usually recommend using like a barrier method while trying to track. And often I'll recommend like taking your temperature. But everyone's so different. Like you could have the slightest, for those that don't know, fertility awareness. Usually you're going to have it in the morning, you're taking your temperature consistently at the same time every day, which is really difficult when you're breastfeeding a baby through the night and you don't really have a particular schedule. You'll have a slight increase in temperature when you're about to ovulate. And then they recommend abstaining during that window, which everyone's a little different what that window is.
That's true. Yeah.
Let's be honest. And then if you use a barrier method during that time, while you're learning, that's an option. Although I can't tell you how many clients I've had come back sooner than they expected because they were still learning that window of fertility. So they're like, well, I thought I was ovulating, but apparently I ovulated earlier or later, and then we didn't use the barrier method. So it's hard.
It is.
It's hard to track. But
it is. Yeah, and I think you're so right about it. Like if you are definitely not wanting to get pregnant, then fertility awareness tracking may not be the best
You
option.
have to really, really know it and really know your body.
Yeah.
And then I usually say the same thing. Like if someone wants to do a barrier method, use it every single time because you don't know potentially exactly when you're ovulating. Well, thank you for coming on the show.
Yeah.
For those who might want more information about you, contact you, Instagram, all that stuff, where should they go?
Yeah, my Instagram is Retrouve Your Wellness, RETROUVAI. It's a French word. Retrouve Your Wellness is my Instagram.
Okay.
And you can find me on Facebook at Retrouve Wellness as well.
Awesome. Thank you, Dr. Chelsea.
Yeah, thanks for having me.
Let us know what you want to hear about, and if you've made it all the way to the end, please leave us a review. We would so appreciate that. Share about it. You can find like more updates and things like that on my Instagram or Facebook. It's at Bethany Stricker Midwifery on Instagram, Bethany Stricker Midwifery Care on Facebook, and then just BethanyStricker.com for website stuff. And make sure you subscribe on Spotify or Apple so you can get notifications for further podcasts. Thanks for listening. Bye.